So I'm so glad that Urban came in because they have been a leader, in my opinion, in making some things happen that probably otherwise would not have happened.
It's about empowering residents in the community to take ownership of that development. And it's giving them the ability to do that by their being involved in all the planning and the subsequent execution.
Before Urban Strategies stepped into the neighborhood, I guess there was nowhere you could turn, no hope for real. You couldn't get the help that you get from Urban Strategies nowhere in the neighborhood.
So USI is a nonprofit organization that uses housing as a platform for community change. Our work focuses on direct practitioner work. So we are on the ground, working directly with families. We're in their homes.
When we walk into a particular community, average income is somewhere between $8,000 and $10,000. The employment rate is roughly 20 to 24%. And we know through our technical solutions that within 3 years, we can double income for the average household and double employment.
Through our Choice Implementation Grant, we focus on a strategy called Results Count. We are working with families that live in the 63106 zip code. Specifically, our target footprint is those families that live in Preservation Square.
And they're focused really around equity issues and valuing diversity and what it really means in terms of wealth creation.
In 2016, Urban Strategies, in partnership with the City of St. Louis and McCormack Baron Salazar, received a Choice Implementation Grant, which is called CNI for short.
The city very much understood that this was a very timely opportunity for real economic progress for a part of St. Louis that has been long neglected. The city elected to be the lead, which I think really demonstrated their belief in their capacity and their desire to implement a successful program. So this was a real opportunity to engage folks on the ground, to really think large about a vision for their community.
The goal of Choice Neighborhoods initiative is to really use the physical transformation of a public housing site to springboard and catalyze surrounding development and investment, and attract additional resources to really kind of create a multiplier effect.
Affinity Healthcare is very proud to partner with USI. We share a similar mission of empowering the community and really helping to build sustainable communities. Trust in underserved communities is definitely key. So USI, through their constant work to sustain these communities, has the trust of the community. If you don't trust your provider, if you don't trust that they have your best interest at heart, we're not going to be successful at improving health disparities.
There isn't any nonprofit organization in America that does the kind of work that Urban does on the ground every day with families and kids in these underserved communities.
If it wasn't for Urban Strategies having, get-togethers, tents, things of that nature, services, then I wouldn't have healthcare. Because people don't want to go to the doctor because it's so high, but if you go through Urban Strategies, they can assist you with getting health insurance. Now I feel more comfortable going to the doctor for any type of illness or pain, because Urban Strategies helped me get health insurance.
Through Human Capital, we focus on strategies that are implemented through employment and economic mobility, education, housing, policy, and health.
We're working locally every day.
They have on their team researchers and statisticians that have pulled together a lot of information, because ultimately we have to demonstrate to policymakers that an investment matters. And the work that Urban Strategies has done is to put a lot of structure around that.
It's a question of staff and having the ability to work in these communities on a long-term basis. This work doesn't change overnight, and having the staying power is very important, and why multi-year commitments from foundations make an enormous difference in terms of sustaining the kind of gains that are made.
And that's why having partnerships are so important. The success of this project depends upon the success of the collaboration between a diverse set of partners that include public agencies, that include anchor institutions, social service partners, neighborhood associations, and most importantly, residents.
This is about us doubling down and partnering with families in a legitimate way to produce outcomes for their households.
When we first started the grant in 2016, the average income for our neighbors was $10,000. Here today, the average income for Preservation Square is $20,000.
So I think that's really great to come from that neighborhood and all the challenges that we faced as a family, you know, to have 2 children that are in college, one graduated and one on the way to graduating.
It really impacts everyone. You know, you may think that you're not impacted by this, but it really is, you know, that's what community is about. It's the collective.
And so it's more than putting up bricks and mortar, but it's more so having a transformational impact that will last a lifetime. It's embedding the values and identifying the resources that has the trajectory to not only change the resident lives that live in Preservation Square, to change the lives of the residents of the city of St. Louis.
Everything has a timeline. Our timeline is to begin today if we want to see a future for tomorrow.